Yes, hello. The title of my poster is Inhibition of Nociception in a Preclinical Chronic TMD Model by Dietary Supplementation with Grape Seed Extract is associated with increased expression of GABAergic proteins in the trigeminal ganglion. So the major take-home on this was in our TMD model, we saw changes in the GABAergic system, and the GABAergic system is one that's involved in descending pain modulation. And what we found is that actually proteins involved in that pathway were downregulated in the model, and that GSE was neuro and glioprotective. So in other words, when we included grapeseed extract as a dietary supplement, that we were able to see basically an increased expression of the GABAergic proteins. And in our model, what we do is we mimic what was shown in the opera studies, that neck muscle tension is kind of a risk factor, as well as prolonged jaw opening. So we induce neck muscle inflammation by injecting CFA. We then open the jaw for 20 minutes, and then we look at nociception, or the pain pathway at different days, and all the way up to day 14. And you can see kind of in these blue bars here that we see this elevated nociception in these animals, and that pre-treatment with GSE, so supplementation with GSE on a daily basis in their water, is sufficient to actually block this. And this is in agreement with data that we've shown for migraine models as well. And then what we want to do is understand the molecular mechanisms by why this was happening. So why was there this increased nociception? And what we found is that there was basically evidence of central sensitization. So the astrocyte GFAP level what we were looking at is kind of a marker of basically central sensitization, because astrocytes are involved in that. And you can see in the TMD model there's increases in GFAP in the astrocytes, and that GSE actually suppresses that. So again, GSE has a protective effect on the development of central sensitization. We then looked at the enzyme that actually produces GABA, which is the inhibitory neurotransmitter, and we were doing this in the trigeminal ganglion. And we saw that in the TMD model, there's actually a decrease in GABA production. So there's a decrease in the inhibitory neurotransmitter. And then when we looked at the downstream effects of that, that's looking at the GABA B1 and B2 receptors. So GABA would bind to these receptors and actually inhibit trigeminal activation. And what we found is in the TMD model that there was downregulation of these two receptors, the GABA B1 and the B2, thus making it easier to excite the trigeminal neurons, which again goes in line with the increased nociception. And then GSE was able to protect that. So GSE treatment brought things back to naive or control levels. So in summary then, what we showed is that in the TMD model, there's an inhibition of the GABAergic system, and basically GSE is able to restore that. Thank you, and hope you're having a good day.